Moving from stage to stage of heart failure is certainly based on compliance with medications, is on following a low-salt diet, and following up with their physician or nurse practitioner to make sure that attention to the details is not missed. So it really is partly patient compliance and partly response to medications. Now, there are actually two different classification systems. One of them is subjective and one of them is objective. The subjective standard, and that's based on the patient's symptoms. As opposed to that is the AHA-ACC classification system, which is much more objective. Otherwise very similar. A is people at risk of developing heart failure. B is people who have left ventricular dysfunction without signs of heart failure. Stage C is people who have heart failure and symptoms. And stage D is people who have heart failure with severe symptoms or at rest. So the signs and symptoms of early heart failure would be shortness of breath on doing activity, difficulty lying flat in bed, swelling of the ankles, and just a general fatigue. So as we get to later stages of heart failure, all of these symptoms get more severe. They will be short of breath at rest, they cannot lie flat in bed, they have to lie sitting up, get marked swelling of the legs and the belly, and they're just feeling very, very uncomfortable, and they cannot catch their breath. We actually can reverse heart failure. In treatment of patients, I've seen patients significantly improve with medication, adherence to diet, and appropriate exercise. But just remember, we're not curing heart failure, we're treating heart failure. In general, I'm an optimist, and I always try and paint for my patients the best case scenario, but letting them know that if things go south, we have options to them.